Hi guys, Dr. Sagar Abhichandani here, and today we talk about why to replace missing teeth and what should be the choice of replacement for the same. When you visit a dentist to remove one or more teeth, you must decide several ways to fill in the missing tooth or the teeth areas. You look around for various replacement options for the missing teeth that can benefit you the most. Among the different dental replacement options provided, a dental implant is the best option. So, firstly, let's understand some important facts. When you go through a tooth extraction procedure, you are left with an empty socket and a bone. With time, the portion of the bone present around the teeth will start to weaken and will ultimately degenerate, as there will be nothing to support it. Eventually, the jawbone will lose its density and decrease in its size. To prevent the bone from deteriorating, your dentist should put a dental implant in the empty socket area to support the missing area of the tooth replacement. So, whenever anyone goes through a tooth replacement procedure, you're bound to suffer from insecurities that ultimately force you to stop smiling. Dental implants and the restorations on top of it look, function, and feel like healthy and genuine teeth. The dental implants are undoubtedly comfortable, which will not let you think you have gone through a tooth replacement procedure. You can floss and brush the implant prosthesis just as you would have done with natural teeth without even having to remove it. This will help you retain the face shape and, of course, your genuine smile. Removable versus fixed dentures. Do we have a clear winner? Let's find out. What's so impressive about dental implants is that it gives us the ability to replace one tooth, many teeth, a full set of teeth as well. Finally, patients who would otherwise need dentures, removable ones, mind you, may find that few implants on the upper and or lower arch significantly improves the stability of a full denture appliance. While our preference as a dentist is always to save natural teeth for as long as possible, we are proud to have the technology in place to replace missing teeth and the foundation they need for optimum functionality. So guys, did you know that humans have been striving for the ultimate form of tooth replacement for centuries? Yes. We can look back in time and see that mankind has tried everything from shells to human bone to replicate the structures of natural teeth when one or more teeth have been lost. Tooth loss has been a prevalent problem amongst adults through the ages. Only recently have we seen a significant drop in toothlessness. In addition to helping people keep their natural teeth longer, dentists today also help them restore the highest degree of function when the tooth loss does occur. So firstly, the old way. Historically, tooth replacements has involved only what we see, the crown of the tooth or the teeth. So the replacement also took place for the crown of the tooth or the teeth. This method serves a purpose and yet it misses the mark. The theory behind dentures is that suction between the artificial fixture and the gums is sufficient to hold all the teeth in place. If the form of the jaw remained consistent after the tooth loss, this might actually work. The problem is that without roots, the jaw does change, sometimes dramatically. When the size and shape of the arch diminishes due to breakdown of the bone tissue, a denture cannot fit properly. In order to prevent slipping or worse, the appliance requires relining very often. And the jaw bones keep changing as well. Remember that. The new way. Today, we know that we need to replace the roots of the teeth if we have a shot at coming close to full functionality. Dental implants allow us to do just that. In fact, research shows that this method of tooth or root replacement is consistently effective, rating in the high 90% for long-term success. Dental implants are tiny cylinders that we place in the jaw. Their titanium composition encourages bone to attach around it, reinstating a strong, reliable foundation for an individual tooth. This is the best thing which could have occurred in the dental field. Let's quickly summarize the benefits of receiving dental implants as a restorative dental measure. Number one, its similarity to natural teeth. Dental implants are the closest thing to having natural teeth in terms of dental restorations. Once the implant is fused with your bone and the healing period is completed, not only does it look similar to a natural tooth, but it can also feel and function as your natural teeth would. This fusing process between the bone and the implants happens during the months after the procedure is done. But once it is completed and the abutment and the prosthesis are attached, there's virtually no difference in the look, feel and function of the implant to that of the natural teeth. Number two, durability. Due to the dental implants fusing to the jawbone, the durability and the efficiency of this procedure is very high. When compared with other dental restorative procedures, getting a dental implant can last as long as it is supposed to. Number three, preventing bone loss that follows the tooth decay. Even though it is not as directly visible as a loss of a tooth, one of the major damages that can occur after the loss of a natural tooth is bone loss. This occurs because the bone is a living tissue upon which the teeth are located. This living tissue requires stimulation in order to keep the rebuilding itself and staying alive and healthy. This particular stimulation of your jawbone happens from the existing teeth, and when a tooth decays, fall out or is extracted, the bone that was supposed to evaluate starts to get resorbed. Bad. So when the bone starts resorbing, one of the most visible things that happen in your face is its shape loss. If you are someone who plays sports with the risk of getting hit on and around the jawbone, the bone loss after a tooth is extracted makes the jaw more prone to fracture as well. A dental implant can prevent or minimize this from happening since it stabilizes the jawbone back to normal with the use of metal implant that fuses with the natural bone. Number four, safety for natural teeth. The reason for extracting an infected tooth is not only to give you relief from the pain that occurs by a decaying tooth, but also to protect the other teeth in your mouth as well. However, many tooth replacement procedures that follow a tooth extraction, such as bridges, dentures, often put extra pressure on these surrounding natural teeth, which increases the possibility of them having problems later on, like sensitivity, decay. A bridge treatment requires support from the adjacent teeth. Partial dentures also require the support from the surrounding teeth to hold on, which may cause them to loosen over a period of time. Even though there are no immediate risks, a dental implant stands on its own and therefore does not cause any additional stress or pressure to the surrounding existing natural healthy teeth. Number five, easy maintenance. Dental implants are one of the easiest tooth replacement procedure when it comes to aftercare. It does not require any special maintenance apart from maintaining good general oral hygiene, unlike dentures or some other similar procedures. Since it is a fixed replacement option, you do not need to remove them and care for them daily other than conducting your regular oral hygiene routine. Receiving a dental implant from a well-trained implant dentist makes for a long-term investment of your oral health. Remember, my dear friends, go by what the science says instead of what you hear or overhear. Dental implants are the number one choice. I repeat, number one choice for replacement of missing teeth. If done correctly in experienced hands, the results can be as good as natural teeth, if not better. Make the right choice, my dear friends. Replace the missing teeth only and not let other good teeth be cut, trimmed, modified, shaped just to act as support for bridges or dentures. Dr. Sagar Abhichandani signing off. See you on the other side. Take care.